Good afternoon, everybody. Thank you, Badri, for inviting me, a stranger to the group. I'm from CMC Vellore, not from Madras Medical or Stanley Medical. It's a pleasure to be in this august company of doctors. You've had an excellent presentation, both from Amy and Dr. Prabhakar. Dr. Prabhakar giving you a glimpse of the causes and Amy taking us through what services are provided for children with special needs. I'm going to take you through a whistle-top tour of what happens in UK. And I'm not a specialist. I'm what they would call in the US a primary care physician or a GP. In UK, the GP is the coordinator and conductor of the orchestra of services provided for children. And our care starts even before the baby is born, at the very thought of conception, because a healthy mother and a healthy father would produce a healthy child. So as GPs, we start working with couples at the preconception level. We look at their lifestyles, like if they are smoking or drinking, we encourage them to change their lifestyle. We assess their general health to make sure that they are generally healthy and able to parent a healthy child. If they have any specific health needs, like if the mother has any specific health needs, these are addressed and she is taken to a position of optimum health so that she could go through a pregnancy without any problems. There's also a fair amount of genetic counseling. We see a lot of thalassemia and sickle cell, and if anybody is a carrier of these, we advise them not to have a partner who's also a carrier so that they don't end up with a child with the disease. And the genetic counseling is not necessarily provided from the GP. We have specialist genetic counselors who would be able to take them through that. Once they are pregnant, the antenatal care that is provided is amazing. The screening that is now available is far beyond what used to be when we were medical students. I can tell you one instance. There was a child who had a congenital heart disease. His delivery was facilitated and he was transferred soon after the delivery to Great Ormond Street, and the child had a surgery on day one of his delivery. Sometimes they can even do this intrauterine. We have an eminent obstetrician in our midst, Dr. Pramila, and if you have any questions on antenatal screening, I would suggest you direct it to her. At birth, most of the births are done by midwives in UK, and they assess a baby by a traditional APGAR score, which I'm sure most of you would have learned in your college days. The APGAR score gives a score of 10. If a child reaches a score of 8 to 10, then usually the child is fine. If the score is between 6 and 8, this child needs some attention. If it is below 6, then the pediatrician are called. The pediatrician is also called during any complicated deliveries like instrumental delivery or cesarean section, or if there's evidence of fetal distress. I wouldn't go into the details of the APGAR score because I'm sure most of you are familiar with it. Once the baby is born, the obstetrician or the midwife assesses the baby. If there's any physical anomaly, the concerned specialist is immediately informed. For example, if the child has talipes equinovarus, the orthopedic surgeon is immediately informed. Or if the child has cleft lip, quite often it's picked up during the screening process, and the child is referred on to a specialized plastic unit straight away. After birth, at the time of delivery, the pediatrician does a detailed physical examination to ensure that the child is physically healthy, which involves checking the head circumference, checking the eyes, ears, cardiovascular system, respiratory system, hips, which is quite important. And once the pediatrician has discharged the child from the hospital, the child is then checked over by the GP at 6 weeks. At 6 weeks, the child is again subjected to a detailed physical examination, and also you take a detailed history from the mother to ensure that the mother and child bonding is fine and the mother has no concerns. By this time, we have picked up any physical anomalies, or if the child has had gross hypoxia, as Dr. Prabhakar mentioned, you might find you suspect cerebral palsy and pick this up early. At school, they have an eye test and an audiology test, because if the child has difficulty in vision or difficulty in hearing, it would affect their schooling and education. So the school nurse does a general check with his height, weight, vision, and hearing. And at school level, most physical anomalies have been picked up. But conditions like, as Amy mentioned, autism, ADHD, are quite obvious conditions and could be picked up before they start school. But children with special needs sometimes are picked up by what we call the educational psychologist. So the referral to the educational psychologist could be made by the GP, could be made by the parent, could be made by the school, so that if any of these three people have concerns, they could ask the educational psychologist to assess the child. And if a child has been identified as having special needs, they are referred to a community pediatric team, which is a multidisciplinary team, which comprises of physiotherapist, speech therapist, occupational therapist, specialist pediatrician, audiologist. So this child is given multi-specialty output and helped in their education. Now, some children are just borderline. They would go into mainstream education with maybe one-to-one input from specialist speech therapists or specialist teachers. Some children will be a little more complex, where they go to a special school. And other children which are very complex go to special needs school, where they are taught life skills. They'll be taught how to use the bus. They'll be taught how to manage money. They'll be taught how to do shopping. So they're given basic life skills that they would be able to manage on their own. But in all this process, the GP is the coordinator of the care. The GP works with the parents, they work with the school, and they work with the child. This is just a whistle-top tour, so you have some idea of the services we provide for children in UK.